Welcome again to Profiles on Nantucket Community Television, Channel 18. I'm Charlie Walters. As you'll see on your screen, we're taping this show on February 28th, 2020. And just in the last few days, there's been increased awareness of the coronavirus. So we thought this would be a good time to bring in Roberto Santamaria, the health director of the town of Nantucket, to tell us what to listen to and what not to listen to. Thanks for doing this, Roberto.
Absolutely. Thank you for having me, Charlie.
Let's begin at square one and talk about what is the coronavirus and how does it differ from viruses of the past?
So the human coronavirus is an entire family of viruses. You may have heard them before, referred to as SARS, MERS. Some of the common cold can be caused by the coronaviruses. You typically hear rhinovirus, which is a different type of virus as well, but it's a general type of virus that comes out of there. The new coronavirus, we're calling it the novel coronavirus, and you'll hear COVID-19. What that means is it's just that it's brand new. It's a coronavirus that we hadn't seen before. So this virus is not a typical mutation like SARS was, where it was a virus that we knew about but mutated and became a lot stronger. This one is a virus that jumped from animals to humans. They believe it came from a bat. And it actually makes a lot of sense, with a city like Wuhan, as big as it is. Bats we are encroaching on the bat territory, so bats are now nesting where humans are nesting. You clean guano, things like that, and that's how it ended up jumping from the bat to the human. You
mentioned Wuhan, China, where this apparently began, and that's a city of 11 million people. If that were a U.S. city, it would be the largest city in the United States.
Yeah, Wuhan is one of the large cities. It's in the Hubei province, Hubei. It's a large province in China and closer to central China. It's a kind of a valley region, and Hubei is just expanding in that area. It's a significant size. And actually, it's home to a lot of the factories. We heard recently about how it's affected Apple's projections for the iPhone. It's because that's one of the provinces where the iPhones get built. It's a massive, massive city. You compare things to LA, New York, but they pale in comparison to something the size of Wuhan. And an uncontrollable outbreak in a city like that can become a big issue. But when you really think about it, there are about 76,000 cases in China. 76,000 compared to 11 million. China is actually doing a pretty good job at containing this outbreak. It's just because it was so new and because symptoms can be so mild, in 80% of the cases, symptoms are really mild, that people don't know they have it. So that's why it's spreading as much as it is.
Well, let's talk about symptoms. What are the symptoms? How do they differ from the garden variety cold, for example?
So people think it's, some of the mild cases feel like a common cold. You'll have a general headache, maybe a slight fever, but the more severe ones feel like a strong flu. It is a very strong flu feeling. You can be down for about 2 weeks, everything from a high fever, above 102 or so, 101, all the way up to the 104 fever. If you have 104, that is a dangerous fever, and you definitely need to call the primary care physician. Headaches, general malaise, muscle aches, it's very similar to the flu.
So you can have serious or severe symptoms, mild symptoms. Can you have it and not have any symptoms at all?
It's more rare to not have symptoms at all, but it is possible.
And anyone who has the coronavirus, are they carriers without fail?
Not always. They're not. Most people, I would say 90% of the time, they are infectious if they have it. But it does happen. It is very rare, but it does happen that a person can have the virus, show no symptoms, but are infection as well.
Now, how do physicians treat coronavirus?
Well, right now there is no vaccine. So we have to treat it, we're treating symptoms is really what it comes down. Keeping fevers down, treating pain, monitoring lungs to make sure that they don't progress to bronchitis or pneumonia. It's It's really strong, and if you have any sort of immunocompromised individual, people with HIV, people on chemotherapies, people with COPD, those are the people you have to monitor closely.
Is there a reason this is hitting in the wintertime? Is this less likely to hit in the summer?
It's, in general, cold and flus, most viruses are less contagious in the summer because the sun is much stronger at that time. Where the Earth is tilted towards the sun, UV lights are stronger, and UV is a very strong antibiotic, antiviral. So you don't see it that often. It's less wet in areas with the summer. Of course, if you're in Central Florida where it rains every afternoon in the summer, you're a little bit more likely to have wet surfaces, but in the summer, it's in general a lot less infectious because of the UV light and because of fresh air circulation. In the winter, you see increased transmission because it's cold, because it's nasty out. People are closing the windows, huddling inside homes, inside town centers, malls, things like that. So they're in close proximity to each other. So it's kind of that multiplication factor.
Now we see newsreel photos or newsreel film on television of Wuhan.
Yes.
And the streets are deserted. You see hardly any cars, hardly any pedestrians. How do these people, how do they get their food? How are they making money if they can't go to work?
It's a big deal. It's when you've isolated a city, or if you've stated mandatory isolation, curfews, quarantines, it starts becoming a real issue because of food, because of work. You'll see people walking around with masks, and in general, the regular little hospital masks that people use don't really prevent viral contamination. You need something called an N95, and you'll see a lot of people using this 95. An N95 means for NIOSH 95. So 95% of all particulates in the air get filtered out in an N95 mask. But you need to be clean shaven. It has to make a proper seal on your face. And then in general, that's how people are going to work. That's how people are getting out and going shopping. But it has interrupted trade. It has interrupted global economies in general. The Dow dropped another 900 points this morning. It is a big deal.
The masks that you should be using, ideally, how expensive are they? They can range to as, $10, $12 for a pack of 10 to $20 for one. It depends on what you're looking for. What you're seeing is a typical painter's mask. You'll see it's the white mask. It has a little respirator right at the tip. It goes around the ears or wraps around the head typically to create a stronger seal. And it looks like a double layered, thicker cotton mask. And then you have the large ones that have the cartridges. Those are the big ones that you'll see in factories. You'll see people who paint vehicles, who do powder coating. It looks like a big rubber mask with two cartridges, or one. It's that pink cartridge that people typically see. That's a regular resin cartridge. Those are the more expensive ones, mainly because all you have to do is replace the cartridge. Those can range up to hundreds of dollars. Now, in the case of China, who's paying for those? Does the government supply any of these for people?
Well, that's considering a lot of it is outsourced into China. They are manufacturing them out there. Yeah, they are manufacturing masks, so it is being supplied. A lot of times, the government does supply them. You can also buy them in the store, but we're starting to see a shortage. And just like in China, as you're seeing here in the United States, where people panic, go out and buy masks, the manufacturers are starting to set aside stockpiles for first responders and healthcare workers because they need the priority. If you start getting your doctors and your nurses sick, who's going to treat the sick when they become patients themselves? So they're being prioritized for these masks, which is where the isolation and curfew becomes more important.
Let's switch tracks here and take some of the information you've just given us and put it on Nantucket. Worst case scenario, there is an outbreak on Nantucket. What happens?
Well, we're a relatively small community, 30 miles out to sea. So if we're having an outbreak on Nantucket, most likely there's also an outbreak in New York, Washington, D.C., Boston. So we won't expect a federal response. If we're the first case that comes here, of course, the CDC will be here quarantining the person, doing all the epidemiology work. In the case of a full-blown outbreak, what we end up doing is you get local control. You get the state epidemiologist's office supporting local departments of health. It'll be my staff and myself. We will be tracking illnesses. We will be asking people to self-isolate. If you have any sort of symptoms, if you're feeling symptoms, do not go to the hospital, call them, because we only have the one hospital.
Okay, that's important. Don't go to the hospital. Why is that?
Yes, we only have the one hospital. So if you present to the hospital with symptoms, and let's say you're confirmed with the coronavirus infection.
And how long does that take to confirm?
It's done through what's called PCR, polymerase chain reaction. So that can take only a few hours.
Okay.
Once they've done the swab and got it out to the laboratory. It takes a few hours.
And the lab is on Nantucket?
The laboratory is in Boston.
In Boston?
At the state laboratory. So that polymerase chain reaction takes a couple of hours. So by the time they swab the person here, get it to the laboratory, it can be 24 to 48 hours.
And during that time, that person
will need to be isolated.
In an isolated room at
Yeah.
the Nantucket Cottage Hospital?
Yes.
Okay.
And there is an isolation room. However, if you're presenting with any sort of symptoms, make sure you call ahead so that they can prepare an isolation for you. That way, if you show up to the emergency room, just walk right in, they now have to shut the emergency room down and disinfect the entire area, which for anyone who's coming in on an ambulance, anyone who's having a real issue, you're putting their lives in danger now too. Presenting to an emergency room while you're contagious, while you're infectious with a disease that has no cure is, for lack of a better word, extremely selfish. It's really important to call ahead. They may just tell you, stay home, and they'll get a visiting nurse, or we can get staff out to them to take the swab. That way you're self-isolating at home and not potentially contaminating the hospital.
I just want to repeat, we're talking about a worst case scenario.
This is a worst case.
We're not expecting this to happen, and we're just trying to get at what would happen if this came to Nantucket.
Absolutely.
And as we speak, 60 people nationwide are infected. So this is not something that's...
Yes.
It may never happen, and if it does happen, it may not happen for who knows how long. But we're just trying to get... We're not trying to terrify people on Nantucket. We're just trying to say, if the worst happens, this is what would happen. Yes. This is what you should do.
Yeah, this is the absolute worst case scenario. We are not expected to ever even reach this proportion on Nantucket. If we get to a true worst case scenario, there's more things to worry about nationally at that point. Really what is happening is we're getting these panic questions. We're getting worst case scenario questions. And a worst case scenario is exactly that. We use those words commonly, but a worst case is if 99% of our fail-safes fail. That's that last 1%. This is that last line of defense. That's what a worst case scenario is. If we're instituting isolation and quarantine on the island, it's mainly because there has been interruptions in treatments on the mainland. There has been interruption of treatment here on the island. So we don't want to panic people. It's really important that all we do right now is to focus on prevention. You're more likely to get the flu on Nantucket than you are to get corona. So it is really important to pay attention. Washing hands, don't touch your face as much as you can. If you do, make sure you disinfect. Purell does work, but it's not ideal. Washing your hands is the most ideal way. Cover your sneezes. And when I say cover sneezes, I don't mean sneeze in your hands. Sneeze. Sneeze into the crook of your elbow. And if you have fabric, that's the best way too. If you use a tissue, dispose of the tissue immediately and then wash your hands.
Doesn't make sense to sneeze into your hands if you've just washed your hands to get them as clean as possible.
Correct.
Now, Nantucket, being a tourist resort, has people from all over the world coming here. Many of them are living here. Right now, we are right at the end of February vacation, so people are returning from places all over. You were talking about UV rays. Come summer, this is going to be less of a worry, I'm assuming, based on what you said?
Theoretically, yes.
Theoretically, yes. In your job as health director, you're obviously prepared for a lot of things that may or may not ever come. I mean, a few months ago, who knew the coronavirus is going to do what it's doing? But a lot of what you're talking about was already in place, wasn't it?
Yes. There are binders inches thick from contingency plans. There's a continuity of operations plans. There are rapid response plans. FEMA, the Massachusetts Environmental Emergency Management Association, MEMA. There are teams of people who all they do day in, day out for 40 hours a week is think of the worst case scenario and how to respond to it, to prevent mass loss of life, to prevent mass infections. As far as coronavirus goes, and even flu, people tend to just say, oh, the flu. The flu is more lethal than coronavirus.
Let's talk about that. The flu is more lethal than coronavirus. Yes. Do you have facts and figures for us?
Yeah, so for example, in the United States, this year alone, we've had over 2 million people infected with influenza. That's according to the CDC's figures this last week. Of those 2 million people or so, over 2 million, we've had over 150,000 hospitalizations. So when you think about it, in order to be hospitalized, these are people who have been admitted to hospitals. To be admitted to a hospital means you are at a severe infection, means you have a fever of over 104, possibly 106, where brain damage is possible. The virus may have entered what's called a hemolytic stage, where you're now starting to have issues with anemia, blood oxygen saturation, pneumonia. These are severe cases, and there are always already 150,000 hospitalizations this flu season alone.
Out of 2 million people. So that's, if my math is correct, 7.5%?
About.
Oh, okay.
And then on top of all that information, we've had about 18,000 deaths already in the United States alone.
So of those hospitalized, that's about, what, 10%? 10% of those hospitalized. So 10% of 7.5. So it's less than 1%
yes.
of diagnosed influenza cases
exactly.
end in death.
That have been hospitalized. But if you don't get hospitalized, if we didn't have the hospital system that we have, mm-hmm. where we are really good at responding to the flu symptoms, those 150,000 people would have been deaths. So that would have been more or less a 7% death rate.
Yeah.
Which is twice what the coronavirus death rate is right now.
But we know how to treat influenza
correct.
Better than we know how to treat coronavirus. So correct. That
yes.
Factor that in when you look at those figures, right?
Absolutely. But coronavirus deaths are actually ending in the same way that a flu death would, which is mostly pneumonia, which is people with COPD or chronic obstructive pulmonary disorders, type like emphysema, things like that. Mm-hmm. People who are immunocompromised, people on strong chemotherapies, or people with HIV and AIDS. Those are also factored into this because we don't know the full pathway of coronavirus like we do flu.
Now, you said coronavirus has been around in different forms for years.
Yes.
But it's only now that it's turned into what it's turned into. Is it theoretically possible that it will turn into something else that's not a problem? That's being the optimist, but is that possible?
Yes.
Is it likely?
Absolutely, it's possible. An organism is not trying to kill itself. If the virus kills its host, it's not properly
Then it kills the
functioning.
virus too.
It kills itself, exactly. So in an optimal environment, a parasite is looking to keep their host alive while keeping itself alive, which is why you see 80% of most infections are very mild.
So there's a contradiction in there,
Yeah.
which we don't need to go into, but
Mm-hmm.
if it does too good a job at keeping itself alive and it kills the host, it's killing itself.
Exactly. A lot of times the machinery, because a virus is mostly a DNA or an RNA strand that hijacks the machinery of your cells, because there's no off switch in that machinery, it'll replicate and replicate and replicate and replicate until it kills off that cell. And then that cell bursts and the virus infects other cells, and that's how it replicates exponentially inside the body. Some viruses are really good at not killing the host. The herpes simplex virus, for example, has been, which is cold sores and other types of illnesses, typically don't kill their host. They have reached a level of dormancy inside the cells. So that DNA continues to live on in that person's body without killing the host.
If I have coronavirus, but I have very mild symptoms, which eventually will go away after a couple of weeks or whatever, is the virus still inside of me, just not doing anything?
It's possible. They don't know enough about it to prove or disprove that. It is just possible that your immune system has learned to work with it and attenuate it when it tries to attack, in which case the virus stays in the body, but your body is fighting it down every time it gets exposed, or you shed the virus altogether. That there are two schools of thought on that, and it hasn't been confirmed yet because this virus is so new.
So I could have the virus, show mild symptoms, my immune system could tamp it down, for lack of a better word, but it could still be in my system, and maybe if my immune system has a problem a year or two from now, coronavirus could start to show symptoms again. Is that?
It's theoretically possible.
Okay.
We see that actually with the chickenpox virus. You get the chickenpox as a child, your body tamps it down, you're immune to the zoster virus for so long. 70 years later, it comes back as shingles.
Well, this may explain why I didn't get chickenpox till I was 40.
It happens.
but not since. They're calling this a pandemic. What's the difference between a pandemic and an epidemic?
So an epidemic is local, is localized. You can say there is an epidemic of the coronavirus in the Hubei province where Wuhan is. So when the virus was just in that area, you're not seeing it anywhere else in the world. So you were calling it a epidemic. Once it has crossed borders and has entered other areas of the world, they refer to it as a pandemic because it is cross-jurisdictional. It has entered other governments. It has entered other continents in the world. There are large barriers that this virus has crossed. So they refer to it as a pandemic. In this case, because it's such a new illness, because it's such a new virus, even one case on the other side of the world, in California or in Australia or even Europe, would have been considered a pandemic because one case more than nothing is considered an outbreak because we've never seen it before.
So in Brazil, there's apparently one as we speak. Mexico, there's one as we speak. The US, I think, is 60. Not sure what Canada is. And yet, it's still considered a pandemic.
Yes.
It becomes a pandemic when even just that one person in Brazil.
Correct. It becomes a pandemic because when you're looking at, we're getting into the nuts and bolts of epidemiology, when you look at what's called an infectious disease curve, it's typically you'll see a spike in flu cases coming from September 30th and March 30th. That's a spike, and you're expecting to see cases there. When the spike of the cases you're actually seeing exceeds the curve of what you're expecting, you call that an epidemic because it's or an outbreak because it's more than what you were expecting. So we're expecting 0 measles cases in the United States, or in Massachusetts, we'll say. You're expecting 0 measles. So 1 case is considered an outbreak because you're expecting 0.
Huh, okay.
In flu, on a normal flu year, you're expecting 100,000 infections. As soon as you hit 120,000 infections, that's an outbreak.
So an outbreak is when expectations are exceeded.
Correct.
Okay. As we're speaking, February 28th, 2020, China has by far the most cases, confirmed cases of coronavirus. It's more than 90%, I believe.
Correct.
South Korea, I believe, is in second place, but they're nowhere near where China is. And I think Japan has passed that. Iran seems to have a pocket, and Italy has a pocket. How can that sort of thing happen? I mean, Italy has a lot, but the country next door, Austria, has next to none or none.
So a lot of times it's when a person has traveled to a country that has it, as soon as there's so much information out there and there's been so much outreach out there that if a person traveled to South Korea, a person traveled to Japan or China, comes back to their home country and starts showing symptoms, just like what happened in Boston, the person says, I just came from an area, I'm not feeling well, I'm going to connect with my primary care and go begin the steps to check. So in essence, it turns into a self-isolation. That the person who presented in Boston did the right thing. That's why we had the 1 case in Boston, and we're now more than 14 days later, no other cases showed up.
In Massachusetts as a whole, not just Boston.
In Massachusetts as a whole.
And this person had been in Wuhan or
This person had been in Hubei, yes.
Okay.
I don't believe this person was in Wuhan proper, in the city proper, but he did come into contact with somebody who was. And then when he came into the United States, he started feeling poor, isolated himself in his home, and called the Boston Public Health Commission. And they were able to get him to the proper treatment. And there were no other cases. They were successful at quarantining that spread. So that's what you're seeing in places like Iran, Brazil, Mexico, because they have just the 1 case. People are showing and it's saying, I've been hearing about this in the news, I should get myself checked out. And it's been very successful at quelling multiple outbreaks.
It may be too soon for you to answer this question, but compared to, say, the SARS virus, is this more worrisome?
It's spreading faster than SARS. SARS is another type of coronavirus. So was MERS, the Middle Eastern Respiratory Syndrome. SARS is a severe acute respiratory syndrome. This is similar to SARS. They're doing direct comparisons with SARS. So in some cases, they're referring to it as SARS-2 because of the family of coronavirus that it's in. It's spreading quicker. It's in terms, it's more virulent. So therefore, it's a little bit more worrisome because it's spreading a lot faster.
Symptoms more severe?
Symptoms are a little bit more severe, but it is very similar. It is very similar. It's another type of coronavirus.
I hear the figures, or the figure 2% thrown around quite a bit. Is that the mortality rate, or am I confusing it with something? Of coronavirus?
Yes, of the novel coronavirus, we're hearing a mortality rate of, some people are saying 2, some people are saying 3.5.
Those figures are coming from where, or from whom?
So you hear 2 from the sources like Medline, things like that. 3 is from CDC and the WHO.
Okay.
And when you're looking at that sort of mortality rate, like we were mentioning earlier, it includes all of the whole spectrum of people, everyone from vulnerable populations to healthy, normal adults. So you look into, to break that down, you have to look into something called the standardized mortality rate, SMR. And the SMR for coronavirus hasn't been established yet because, one, it's too new and not enough people have actually been infected yet. A standardized mortality rate is how many people die per 100,000 infected. So when we start looking at those numbers and we're able to what's called stratification, so saying people's ages 0 to 5, people's ages 6 to 10, those are called strata. And once we start breaking down the data into those strata, we'll be able to tell more complete picture of what that mortality rate is. What the 3.5, the 2.5 that we keep hearing on mortality rate is what we refer to as crude mortality. Of all the cases we're seeing, this is the number. Because they just haven't been able to break it down yet. They're still trying to stop the spread.
Is there a way to make an educated guess on how many unreported or unconfirmed cases are out there?
No, unfortunately, because some cases are so mild, the numbers are always underreported. Flu numbers are always underreported, for example, because some people just take care of themselves at home.
That it's not a severe,
it's not
for
severe.
some people.
So they just stay home. They take Tylenol as a fever reducer. They take a Dayquil, NyQuil, and after a few days they feel okay. We never get that number because they never presented to a hospital or to a primary care and they never did a confirmatory test.
How far away from a vaccine are we, do you think?
Oh, we're months, possibly years. Vaccines are very complicated to create. You can rush a vaccine, which is what you saw with Ebola. Because the outbreak was so heavy, it was the biggest outbreak they had ever seen with Ebola. So there was a lot of money poured into research, and they had a research vaccine that was released in about 8 or 9 months. But that is still just in research stages. They're still just in clinical trials to confirm it. They released it to the front lines in order to stop the outbreak, but they don't know what the side effects were. So now they're in clinical trials to go back and confirm all that. So creating a vaccine is really difficult. The infection mutation, the coronavirus mutation that we're seeing was compared, one of the virologists from the CDC was talking, gave a statement last week, that this viral mutation in the coronavirus going from bats to humans is the same evolutionary jump as us growing a third eye or another hand. It's that far apart to its original genetic code. So this sort of a mutation is not expected.
And yet it happened.
And yet it happened. So creating a vaccine to match that particular mutation, it's a lot of work. It's a lot of work. A virologist will probably be able to map the DNA and start creating something to attack it and respond to it. But then when they bring it to a mouse model, when the immunologist's job, the immune response in the mouse might be lethal to the mouse. So you're back to square one on how to create a new vaccine.
On Nantucket, you often have dormitory situations where large numbers of people are living in the same place. Or you might have a large family or a couple of families sharing a house down here. In other words, close proximity in a small space. For day-to-day living for those people inside an environment like that, anything you can say in addition to what you've already been saying?
So that's where when it comes to a dormitory living environment, it comes to a large family living environment, it's often not possible to go to a hotel to self-isolate, that sort of thing. That's where that N95 mask comes into play. If you're going to be living in a close quarter, a person who is sick should be wearing the mask. People who are interacting with a sick individual could also be wearing a mask, should be wearing a mask at that point. What's really important right now is that the way coronavirus is being transmitted is through droplet form. So a person sneezing, a person coughing, a person blowing their nose. So usually when a person sneezes, the droplet only comes around about 3 feet, droplet form, and then it starts settling out of the air. So that 3-foot radius around people, when sometimes we refer to it as a personal bubble, that is actually very important. The personal space part is very important. Maintain that 3-foot barrier when interacting with people. It will really be strong at preventing transmission person to person. And then you have to make sure you're cleaning the surfaces. Every person who uses when they use the restroom, if the infected person is using a restroom, every time they shower, when they go to the kitchen, they have to make sure they disinfect the surfaces that they connect with. When you're looking at the back of a Lysol wipe or a Clorox wipe or any sort of disinfectant wipe, there's usually a section on there that says contact time. So simply wiping it down with a Lysol wipe isn't going to kill off the viruses. Contact time is usually 4 minutes to 10 minutes.
Oh boy.
So you have to wipe it down, make sure it stays wet, wipe it down again a couple minutes later to make sure it stays wet and it has to air dry. The contact time is the most important part. Simply wiping something down with Purell or a Lysol wipe doesn't work.
Not as simple as most of us might think.
It's not simple. It's not simple. Actually, as a result of how complex it actually is, the FDA last week requested that Lysol, Clorox, and other disinfectant wipes remove that saying that it kills 99.9% of flu and Ebola viruses because it's required to be on that contact time. On average, your average person doesn't use the contact time. Imagine wiping down your kitchen sink and staying there for 5 minutes, making sure you wipe it down again and wipe it down again and make sure it stays wet for 5 minutes before you let it air dry.
Before we go, I just want to repeat what I took to be the most important thing you said. If you think you might have coronavirus, I know it's a big if for most people, but if you think you do not go to the hospital. Call the hospital.
Call the main line. Call your primary care physician. Do not just show up. Same with flu. We're in the midst of a flu outbreak in the United States. If you believe you have the flu, call your primary care provider. If you believe you have coronavirus, call your primary care provider. That barrier is extremely important.
And I've heard on television more than once, if you want more information, do not go to social media. Repeat, do not go to social media. Where should we go?
So the Town of Nantucket website has a page dedicated to the coronavirus right now on the health department page. That's nantucket-ma.gov.
And if you can't remember that, just type in Town of Nantucket and it'll take you right there.
Just Google Town of Nantucket. You can also go to cdc.gov. It's
Center for Disease Control.
Centers for Disease Control. And the World Health Organization. That's who.int. There, and it's right on the front page.
Roberto, thank you very much for doing this. This is timely to say the least. And again, we don't want to panic people, but we all should have this information.
Yes. It's good information to have. Always look for more information at the proper locations.
Yes.
CDC, the World Health Organization. As of right now, as of today, there is nothing to panic about. It is really important to just wash your hands, try not to touch your face, make sure you're living in your more cleanly environment. Cleanliness is really important, especially washing your hands. That's the biggest takeaway because you can prevent flu, you can prevent corona, you can prevent common cold, you can prevent even foodborne disease with the simple act of washing your hands.
And washing your hands means soap.
Does
not mean just hot water for a split second.
It is warm to hot water with soap. Make sure you lather. Soap is mechanical. So you can't just spread soap on your hand and expect it to work. You have to rub them together, get bubbles Those bubbles create something called a micelle, which attacks the dirt and traps the mice. The micelles trap the dirt, trap bacteria, and wash off. As you're washing your hands, wash at the very least up to your wrist, sometimes up to your elbow, especially if you sneezed. Sing happy birthday to yourself twice. That is generally the amount of time that you need to wash your hands. 30 seconds is typically what you need to wash your hands. That's a long time.
That is a long time.
That's a long time.
Roberto Santamaria, thank you very much for coming in and educating us about this. We appreciate it.
Thank you for having me here, Charlie. I really appreciate that as well.
For Nantucket Community Television, Channel 18, I'm Charlie Walters. Thank you for tuning in. Join me again next time.